There's no intro music on this one. Welcome to today's podcast. There's no intro music for a reason. We're actually broadcasting this particular episode on two different podcast platforms. I typically have two different audiences, and although we have lots of clinicians who listen to our public-facing podcast, which is Women's Health Unplugged, probably very few of you public listeners or health seekers, we'll call you, listen to our clinician-facing podcast, which is the Confident Clinician Podcast. But when I sat down to do this episode, I realized we all needed this conversation, and I wanted the conversation to be high enough level that the clinicians would benefit from hearing it, because my argument on this particular topic of hormone imbalance is really that we're doing people with ovaries, women, a disservice by dumbing down the conversation about what's happening with their hormones, and it's actually causing harm. And so I actually wanted everyone to just listen to this episode, and so we decided to put it on both channels. It's for clinicians, it's for patients. We're going to talk about the term hormone imbalance. So this is important because when we talk about labels, and I know we all want to be special and magical and this unique unicorn, and you are, right? You are your own unique individual person, and probably the methods that we pick for the solutions should have an element of individuality. And we are seeing that show up in the research, that the way we help coach you around behavior change, the way we help support you to make nutrition modifications should be based on who you are, not just what the research says. We need to adapt research to be culturally appropriate or to meet your income level. We do know that the solutions that we provide for patients do need to have some element of individuality to it. However, when we're talking about labeling with respect to diagnosis, this might actually be a label that you actually do want to achieve, because the way that we start to support someone has everything to do with the way that we assess them. And so the term hormone imbalance, and where this comes from, I think, is that diagnostics in endocrinology and in hormone conditions is not easy. And for people who menstruate, so many conditions ebb and flow and fluctuate with the menstrual cycle, even if they themselves are not hormonal in nature. And if you have PMS or if you have cyclical symptoms, you may have noticed that your mood gets better or worse with your cycle, that your joint pain gets better or worse with your cycle. So teasing out, other conditions from hormones is challenging. And there's so many vague symptoms that people experience that do potentially have a hormonal root to it. And because we've generally dismissed a lot of women's health concerns in medicine, it's led to this need for people to seek alternative answers and alternative labels to describe what they're experiencing, because they haven't really neatly fit into, sort of this medical box. And I think that's where this term hormone imbalance comes in. And for the clinicians, we've all seen patients where they're moody, their cycles aren't great, they maybe have breast tenderness, and they don't feel quite like themselves, in quotes. And so we can see that there's this hormonal nature to the things that they're experiencing, and their symptoms are maybe they feel like they're a bit hormonally excessive, right? If someone has very heavy bleeding, or if someone has a lot of bloating or a lot of breast tenderness, it feels like their hormones are out of whack, right? In air quotes. It's not a medical term, out of whack. And I think that the collision of women feeling undersupported and not heard, and us also seeing these symptoms show up in patients that maybe don't beautifully fit diagnostic criteria, or we're trying to acknowledge and honor the way that people feel, even if they don't fit into a diagnostic box, we've started using this term hormone imbalance and balancing hormones as the solution to describe how we support people who have hormonal symptoms. And my argument today is that that is actually causing some harm for us to use that terminology. And I want us to move away from it and more accurately describe what's happening to our patients and people listening. I want you to better understand what's happening in your bodies so that we can all be on the same page as we start to talk about these hormonal symptoms, because not all of them are from a hormone imbalance. So first off, language really matters. It really matters to me, like above and beyond this conversation. I am very much a love language words person. Language really matters to me. But it should really matter to you also as a user of the healthcare system or someone who is part of that healthcare system. The moment we start to use words that are, maybe just slightly adjacent to the true words or the true terms, we start to create an interpretation of what we're saying that's left up to the listener versus using the most accurate language to talk about something. And I think we've come to change the way we teach our young children about even their own anatomy, right? Where maybe we would have called, the labia, the vagina, the clitoris, and the anus all just your privates. We've learned that that's not actually helping educate, that younger generation on how to best take care of their bodies if we use obscure language or if we use like this proxy language to describe what we're actually talking about. And I would argue that the same is true with hormone imbalance. Like, why is it that we don't think that we can use the real terminology to describe what's happening there? The term hormone imbalance might be way catchier than the terms we might use to describe what's happening. And it may float better on Instagram to use the term hormone imbalance. But my argument is that that's kind of the same as calling someone's genitals their privates and not going into any deeper explanation about what's going on there. It's really doing a disservice to the patient when we use that kind of terminology to describe what's happening in their body. The other thing that does is it means that we're not speaking a universal language with their other healthcare practitioners. And so when we send someone to another practitioner, and every single patient we work with as healthcare providers has more than one provider, right? You have more than one person on your health team. And when you take that terminology that's adjacent, right? Like it's not completely flat out wrong, but it's not that accurate. And you start to use that information to describe your experience or describe what your other practitioners are treating. Now we've created a health game of telephone where your second provider doesn't really know what the first provider is treating. And if they don't agree with the terminology, all that does is leaves the patient in the middle feeling confused. Well, my naturopath said I have a hormone imbalance, and then their medical doctor says, well, that doesn't exist, right? Like, look at the harm that gets caused by that very, very simple and very common exchange. When the integrative practitioner uses a term to describe what they're doing with a patient, and that term doesn't exist in conventional care. Now we've put the patient in the middle where they need to decide who they trust, which terminology they resonate with best. And if they choose their integrative practitioner, they may be denied other care in the conventional side that we certainly wouldn't want them to avoid. And if they decide that they agree with their medical doctor and their naturopathic doctor is flaky, now we've lost an opportunity to support them on the integrative side. And so not only does language matter so that the patient more deeply understands what's happening in their body, it also creates a universal language for how we're talking about something so that everyone can be on the same page, and we're never putting the patient in the middle where they need to defend one of their practitioners. Their naturopathic doctor may not be wrong about how they're treating it, but the way they've described it as a hormone imbalance now has negated how effective their treatments might be, right? And now again, we've put the patient in this weird like middle person that needs to be the go-between between their integrative practitioner and their primary care doctor. There's also lots of harm that comes from labeling someone incorrectly. And I think we can see perfect examples of this in other areas of medicine, right? We don't want to label someone with something they don't have. Like that's catastrophic, right? Like, and if we use a very emotional example, we don't want to misdiagnose someone with having breast cancer when they don't have it, right? Like A, very stressful. B, it puts them into a path with their healthcare that exposes them to things that are risky, right? Scans, biopsies, potentially medications. We never want to call something it isn't, right? We never want to say, oh, that thing, we're not 100% sure, but we think it might be breast cancer. We can see very clearly how that example would cause undue harm to the patient if we accidentally diagnose them as having the wrong thing. And when we diagnose someone with having a hormone imbalance, which that diagnostic term in and of itself is meaningless, right? Your hormones can be imbalanced, but the term hormone imbalance is not a diagnosis. When we call you with having something, when we say you have something that you don't have, what does that mean? Well, similar to the breast cancer example, you maybe have tests you don't need, which may have risk. You may spend money you don't need to spend on interventions, testing, or otherwise that you don't need to spend. And you also start to move down a path, right? As soon as we've labeled you with something, and we see this in the research often, when doctors label you with something and you come back 3 months later and you still have symptoms, we have an awfully difficult time reassessing you. That's very common in the research. We know this is a particular cognitive bias we have in medicine. Our first idea is the idea that we stick with way longer than we should. So if we label you wrong, if we label you as something that's not really that well descriptive of what you're experiencing, the chances of us as your doctors putting down that label and choosing a different label, like iron deficiency, is less when we see you the second time. We have a very hard time reassessing you, statistically. So we don't want to call you as having something that you don't have. We don't want to label you as something you don't have, because that label has consequences. It has consequences that we expose you to things, tests, treatment, etc., that you maybe don't need. And it also has this potential to stereotype your case in a way that makes it hard for us to find the real answer later. We also don't want to not diagnose you with the right thing. So in statistics, we call this sort of like a false positive would be where we say you have it, but you don't, right? My breast cancer example would be like a false positive. But a false negative would be not calling you having something, but you do. And so if we call something hormone imbalance and we label you as a hormone imbalanced person, what are we not doing? We're not giving you a diagnostic label that we do understand. And even though like diagnosis is hard, it's actually my favorite part of medicine is the assessment. That's my favorite part, is figuring out what's wrong. It's the best. That's the like Dr. House part of my job, is figuring out what's wrong. It's my favorite. Even though diagnosis is hard, I mean, there's not an infinite number of things that go wrong with hormones. There's maybe 6 or 7 categories of conditions that can go awry with female hormones that we should try and put you in one of those boxes, or maybe 2 boxes. Because when we do that, what happens? If we accurately diagnose you as having a particular disease or condition that influences your hormones, what happens? You start down a path towards better. You get offered tests and treatment and referrals, the things you'd need to actually improve. So the language matters. Because if we don't use the right language and we don't diagnose you accurately and we use a term, hormone imbalance, that's not really that accurate and not universally recognized, what did we just do? We just blocked you. We blocked you from getting access to the care that you probably do need. So that's why it's important that the terminology matters. And that's why I want to stop calling it your private parts. And I want to start calling it what it is. Let's diagnose you accurately. Let's use terms that are real. Because yes, your hormones may be under the surface a little imbalanced in perimenopause, but the diagnosis is perimenopause. And forgive me for calling perimenopause a diagnosis. You know what I mean? I'm not saying that that's a disease. I'm saying the accurate term we would use to reflect your state would be perimenopause, not hormone imbalance. So where does that leave us? This is a hard one, right? Because you can clearly see where we've taken sort of a wrong term around using this language, hormone imbalance. Because the funny thing is, and I've spent a lot of time looking at the various buckets. I always use the term buckets instead of boxes that we fit patients in. I think bucket is a much better term. There's various buckets that you can fit in that have hormonal symptoms associated with them. Some of the common ones would be like PMS or PMDD, which the symptoms are often cyclical in nature, but you have regular periods, right? Your periods come and go relatively regularly, and the symptoms come and go regularly with your cycle as well. Then we have things like PCOS, where you may have irregular cycles or other more testosterone-driven symptoms like acne and hair loss. We might have perimenopause, where your cycles start to get irregular, right? So you can see from a question asking perspective, this is why we ask you all those questions. Are your cycles regular? Do your symptoms come and go with your cycle? What symptoms are you experiencing? Acne, hair loss, cramps, breast tenderness, bloating, headaches, right? The reason that we go through these questions is not to say, oh, your estrogen's high or your progesterone's low. It's so we can best fit you into that bucket that you belong to. So perimenopause, we start to see irregular cycles, right? There's also states with just flat out low hormones, which menopause would be, maybe the most common example, but we can have low hormones for other reasons, whether it's from dieting and disordered eating, whether it's from other genetic challenges where we may have loss of ovarian function before the natural age of menopause. And so when we're questioning you and asking you about your experience, what we're really trying to do is help us better understand which bucket you fit in. Because if we kind of know where you belong based on your assessment, what happens? We send you for the right tests. Then we use those tests to help us solidify our answer around what's happening with you. And those tests should include looking at brain-based hormones like FSH, LH, prolactin. It should look at your ovarian hormones, but it should also include a differential of other things that cause the symptoms that you're experiencing. I mentioned iron deficiency. Because even though you may feel like your symptoms are hormonal in nature, it doesn't necessarily mean it's coming from your hormones. And it's very common that people feel like their hormone levels are going to be abnormal, except in a lot of those examples I gave, like PMS, for example, the hormone levels of a person with PMS are the same as a person without PMS. So that hormone experience that you're having is not even really related to the numbers being imbalanced. You can see why I hate that term, hormone imbalance, so much. Because quite often we're talking about someone with PMS, right? Like that example I gave you at the beginning, breast tenderness, bloating, moody, don't feel like themselves part of the month. That's that PMS experience, and your hormones aren't imbalanced. Your body's sensitivity to your hormones has changed, and that's a huge differentiator. So how do we go forward now, right? Like, what do you do now? First of all, we're going to put down the term hormone imbalance. Whether you are a patient or you are a clinician, we're going to start calling it hormonal symptoms, right? You're experiencing hormonal symptoms. Your patient is experiencing hormonal symptoms. And instead of us wrongly diagnosing you or wrongly labeling you, because what does that do? It puts you down a path of assessment and treatment that you don't need or don't deserve. And we want to correctly diagnose you and give you an appropriate label that actually more accurately describes what's going on in your body. Remember my private parts example. We need to stop calling hormonal symptoms your privates. Let's use the real terms. Do you have endometriosis? Do you have menstrual cramps? Do you have mastalgia or breast tenderness? Do you have PMS? Do you have anovulation or lack of ovulation, which will sometimes cause low hormones? Are you in perimenopause? Do you have PCOS? Because when we start to move outside those most commons, which I just labeled there, menopause too, I would throw that in there. When you start to move outside of those most commons, that's where you really need deep assessment and probably support from an endocrinologist or a hormone doctor. But if we use this blanket term, hormone imbalance, what have we done instead? We've discounted so much of your experience. We've blocked you from accessing a lot of the assessment and probably the treatment that you would require to feel better. And so that's why, in defense of the terms, the words, the language that we use, I think every person listening to this podcast deserves to know exactly what's going on with their hormonal symptoms. And unfortunately, sometimes the answer when we're talking to people about their hormones is that your resiliency to your hormones has changed. And we've talked about this in other episodes, like when we talk about PMS. PMS and a lot of the symptoms around perimenopause is that when our hormones fluctuate, it's just hard on our bodies and brains. And the older we get, the more stressed we are, the more depleted we are. Natural ovulation changes and natural hormone changes with respect to ovulation start to become less tolerable. And so for so many people who are seeking this diagnosis of hormone imbalance, your hormones are fine. Your hormones are balanced. It's your life, actually, that's probably imbalanced, and that's what's making you respond so significantly to your hormone changes. So I totally understand why in the wellness community we wanted to create a label, or we wanted to acknowledge the way that people are feeling with respect to their hormone symptoms, which is why we've created the term hormone imbalance. But I also am so interested in you getting the right diagnosis and the right care. And so I'm going to ask us as a group to put that term down, to stop calling it our private parts, to start labeling our patients appropriately with the terms that reflect a universal language in medicine. If I send my patient to their doctor with a letter that says, my patient's in perimenopause and here's how I know that, that is so much better respected than me having my patient leave my office with the term hormone imbalance in their head. Even though maybe both terms are trying to describe the same thing, the universal language in medicine is what starts to build bridges. And if we use our own made-up terms, we're going to create conflict where we don't need it, and we're going to put our patients in a position where they need to choose. So we're going to put down the term hormone imbalance. And if you've been leaning on that as a diagnosis, we're going to improve our understanding of those other conditions that cause hormonal symptoms. And actually, as a sort of leadership move here in the Confident Clinician in February, we're actually doing an entire revisit of differential diagnosis of women's health and gynecology to help you actually understand how to read the lab work, how to know where the patient's lab work should look based on where they sit in their cycle, the questions you need to ask to figure out which buckets your patients belong in, and how you use lab work to do differential diagnosis, and why we don't use any of the functional diagnostic testing like urine steroid hormones or saliva hormones, etc. We're going to help our clinicians become absolutely in love with differential diagnosis in gynecology, so that we as an entire community can stop using the term hormone imbalance. Now, for you as a patient, if you've experienced this term, and if this term has been used to describe how you feel, I would love to invite you to ask your practitioner to describe it to you in more detail, because it's totally possible that they've used the term private parts to describe something more complex, and you deserve to understand that better language and terminology so that you can bridge the gap between your integrative practitioner and your medical doctor. And if they can't describe it to you, you also deserve to have a second opinion so that someone can actually help you understand what's going on with your hormonal symptoms and ensures that we are actually barking up the right tree. Because the biggest risk by us using a term like this is that we've missed something, and that you're missing the label that would be step one to get you on the path towards feeling better. I've always loved the term, and I've borrowed it a million times from my colleague Matthew Leonardi at the endometriosis clinic. Endometriosis is so misdiagnosed and misunderstood that it can take 10 years for someone to be accurately assessed. And he's always used this term, diagnosis is treatment. Because if we don't accurately diagnose you, we never put you on a path towards getting access to the people, the solutions, and the tests that you require to get better. So that's my argument for why we shouldn't use the term hormone imbalance, and why I'm inviting all of us to do better for each other so that we can get women the support they deserve. There won't be any outro music either. And if you hung on this long, and I mentioned at the beginning of the podcast, we actually broadcast this episode on 2 platforms, the Women's Health Unplugged platform, as well as the Confident Clinician platform. And just to call out how both groups of you can get more support. If you're a patient and you're listening and you need better support and better diagnosis, I'm going to invite you to explore the practitioners that work at Clarity Health, which is my naturopathic clinic in Ontario. We service patients all over Ontario virtually. And if you're not in Ontario and you're looking for a practitioner, you can actually find a Confident Clinician, verified clinician on our directory at the Confident Clinician website. And if you're a clinician listening, I'm going to invite you to consider joining our community, the Confident Clinician, in January when the doors open. As I mentioned, our first module and installment in February for our new clinicians and all of our 650 old clinicians that are part of our program currently, we're doing a deep dive into gynecology to help us move past this diagnosis of hormone imbalance as an entire community. We know that if we want to sit at the table next to our patients, practitioners, that we need to be on the same page and be speaking this universal language. And we're spending time there as an entire community to help people deeply understand why this language is so important and how to help them be more confident in that differential diagnosis of hormonal concerns, because we're so often that primary touch point for people that are struggling with their hormones. And so we deserve to have more confidence in this area as practitioners, and our patients deserve that from you too. The links to all the things that you need to get better connected from this episode, regardless of who you are, in the show notes. So I would invite you to go and have a look at those, and we will see both groups of you next week